Let's look to another story this week. The appointment of Lester Levy as a new Uber Health Commissioner to replace the new bureaucracy that was born out of Labor's health reforms and is, according to reports, overspending or has been overspending at the rate of $130 million a month. That's the overspend. From now, what is it? It's not the Health Ministry, it's the Health New Zealand. Thank you, Ben. And it's all just names for bureaucrats. We had a really interesting chat with Des Gorman about this, who said the reforms were always bad and dodgy, and we need something more out of it. And the New Zealand Initiative has come forward and says, yes, here is an opportunity to put things right. The question is, how do we do that? And for some idea, we're joined now by, I guess we'll call him Policy Wonk, analyst from the New Zealand Initiative, Bryce Wilkinson. Bryce, nice to have you back with us. Welcome.
Yes, good morning, Sean.
All right, so here is this opportunity to roll back a reform that many criticised and said wouldn't work. How easy will it be to do this, to stop the $130 million a month burn and come up with a system that is fit for purpose?
Two different things, aren't they? I think the first one, it seems clear that, and Lester Levy seems to be very confident about this, and he's in a position to know, to save a lot of money and improve sort of services, reduce waiting times at the same time. And that's the immediate task he set himself. And that's a task you do with the existing structure. But I agree with Des Gorman, of course, that the structure itself didn't make much sense at all at the time it was put in place. And it amalgamated, with those hospital boards. And you cannot reverse that in a hurry. It's a big, complicated task. And I don't know if anyone's got a good blueprint for it at the moment. But the central thrust is right, is that centralising everything in Wellington looks like a bad idea, and devolving choice back into the community a lot more, distributing power to make decisions for local communities around the country is a much more sensible way to go. But there are lots of ways to do that.
Can you explain to us, Bryce, and it's still something I struggle with, what is the difference between Health New Zealand and the Ministry of Health, and where do the lines of responsibility fall?
The Ministry of Health is the sort of policy department, and Health New Zealand is the department which actually is operational, actually operates all the hospital boards and the delivery of services. So it's the one which really knows, or should know, what's going on around the country and organising epidemic responses. And that
so it delivers. It's the delivery arm of our health system, right?
Yes, yeah.
Okay.
Yeah. So,
at the moment, it's in chaos, right?
Well, I'm not an insider to it, but it was a massive job which it was given, and you've got to have some sympathy for it, because I think it was a bad idea at the start, and particularly to try and do it during an epidemic period. So, to some degree it was set up to fail.
Yeah, I hear you. Okay, obviously senior staff are going, board members are going. Is that a great loss? Isn't it the practitioners, the nurses, the orderlies, the doctors we should be spending our money on? Surely every dollar we save at administration is a dollar that gets to the front line of delivering health services.